From a very early age, for whatever reason, I wanted to treat children that are born with facial deformities. I don't remember how I came across the picture, but I remember seeing a picture at some point when I was young, and I said, we got to be able to treat them, and I want to be able to be part of that. So I found out that you had to be an oral surgeon to do this, and I decided to go into dental school to treat patients with cleft lips and palates, and that's what I do now. Every year, for about 2 weeks out of the year, I go abroad and I treat patients that are born with facial deformities. I've been to Dominican Republic, I've been to Tanzania, I was in Myanmar this year. I go all over the world for about 2 weeks, and I volunteer my time to do these surgeries and change people's lives, and that's probably the best 2 weeks of my year. Some patients have had really bad experiences as children or have these frightful memories of going to the dentist. So I take pride in giving them one very positive experience and then slowly bringing them back up so they can be able to tolerate the treatment that they've been putting up for 20, 30 years.
My name is Laura Van. I'm a pediatric dentist here at Park Smiles. So a lot of kids can be scared, right? And that's normal because kids, or anyone, is scared of what they don't know. And so that's our job, especially my job, to make sure they feel very comfortable. So I think the biggest challenge is probably kind of breaking down their first impression or first fear. But once we tell them, it's very happy here, we're here to just brush their teeth and have a great time, then I think that, they're very happy.
My name is Dr. Greg Ray. I'm the general dentist. I do kind of all the routine stuff for adults in the office. My philosophy in practice is that I treat every patient like their family. So I look at a patient and I decide, is this my aunt? Is this my mother? Is this my uncle? Is this my brother? Is this my son? And that's what I picture. I say, okay, if this was my son and this is the situation that was presented with, what would I recommend they do? It works out really well for us to have all the doctors in the same office. So like if I have a patient that I have some questions about oral surgery, Dr. Cohen's right here. Or if I have questions about endodontics, Dr. Heck is right here. The ability to have the access to all the doctors right in the office, all staring at the same x-ray, thinking, kind of in real time, what's going on, what is this, we kind of talk it out loud and kind of figure it out, and we usually can come to, a pretty good conclusion with it.
Our practice is a multi-specialty dental practice, which just means that we have specialists in all areas that are going to address all your needs. So whether you need a tooth pulled and see the oral surgeon, or you need a cleaning and you see the hygienist, or you need a root canal, you see the root canal specialist. And I love being able to just pop into a room, and my pediatric dentist has a little kid and she has a question about something. I can pop in and put everybody at ease in a couple of minutes, so that we're not rescheduling an appointment, going to another office. It's just nice to be able to have everything under one roof. We have the best team in New York City. There's no one like us out there, and in New York City, it's really nice to be able to get all your needs done at once.